Hello everyone, my name is Abby Williams. This is my presentation on smart beds. So what are they? They're inpatient hospital beds that integrate technology to track patient movement, temperature, weight gain, weight loss. They also reposition and improve patient safety. I have three models that I want to show in this presentation, and they are the Hillrom Centrella Smart Bed, the ProBed Freedom Bed, and the Sizewise Behavioral Health Bed. The Hillrom Centrella Smart Bed. This bed is designed for short-term hospital stays. According to Hillrom in 2020, this bed is designed to keep patients safe and simplify caregivers' work. This bed has many features on it for both caregivers and the patient. The Centrella bed has verbal alerts, such as break not set, call light not attached, please do not get up, and care team has been called. This bed also has Early Sense, which provides contact-free continuous monitoring of heart rate and respiratory rate to enable earlier detection of patient deterioration. This is a sensor that's placed under the mattress that inputs their vitals directly into the patient's EMR. This bed also features Watch Care. It's an incontinence management system that provides real-time incontinence alerts to reduce patient exposure to moisture. This pretty much just alerts the staff if the patient would need personal hygiene or care and would decrease hospital-acquired skin injuries. Other features on this bed are visual projections on the floor. So if you look up at this picture, those 4 green lights on the bottom tell you what's alerting on the bed. There's a night light on this bed to aid the patient to and from their bed so they can see. Easily visible handrails, a touchscreen for bed controls, and bed alarms. There are some features for the patient, such as a USB charging port, device storage area, and a patient pendant that gives the patient control of the bed, and it confirms for them that their caregiver has been called if they push their call light. This is the ProBed Freedom Bed. This is designed to help rotate the patient. Ease of repositioning and rotation of the patient. These beds are designed for bed-bound patients, patient with neurologic deficits, to help rehabilitate or in-home use, maybe long-term care. The features listed on the ProBed website are manual and automatic rotation, adjustable angle of rotation, dwell time, air-powered torso and leg raising. You can place the patient in Trendelenburg or reverse Trendelenburg. The side rails move with the patient while being rotated, and optional voice control. The dwell time on these beds can be set to the exact minute for when the patient needs rotated. So rotating these patients every 2 hours or 4 hours or however long just reduces pressure sores and ulcers and skin injury, skin breakdown. I think it would decrease caregiver back strain and injury by rotating the patients. They are pretty small. I don't think they would be used in the hospital. And the Sizewise Behavioral Health Bed. This bed is designed for behavioral health patients and for their safety. These beds are ligature resistant. The bed controls can only be accessed with a lockout key, so the caregiver nurse would have to place a key on the bottom of the bed where the foot controls are, so to adjust the height of the head or the feet or whichever, so the patient cannot harm themselves electrically or by positioning the bed. The features listed on the website for this bed include quick release side rails, quick release power cord, tamper resistant fasteners with security screws. These beds also have optional restraint loops for soft limb restraints or locked restraints in an attempt that a patient would try to harm themselves or somebody else. These behavioral health beds are also intentionally low to the ground, so the patient can't raise the bed and try to use them as a ligature setting. And they all include bed alarms. These beds are versatile and can be placed I think anywhere. For any behavioral health patient in the hospital, in the emergency room, in the ICU, on a behavioral health unit, I think they would fit just about anywhere, and to ensure patient safety and that they wouldn't try to wrap the sheets around things and try to harm themselves. Why they're needed. These beds can be used to improve patient safety, improve monitoring, and patient comfort. Most smart beds are designed with patient safety in mind. They all include bed alarms. The Centrella bed has night lights and side rails that light up, and the confirmation of the call light. I think these beds increase comfort and would deter the patient from getting out of bed without help if they know someone's coming to help them. These beds improve monitoring. They have the capability to monitor temperature, weight, movement, pressure areas, incontinence, and other things. The data can be directly inserted into the medical record and trend things like fevers early and catch it early to prevent conditions and reduce hospital-acquired injuries. Patient comfort. From my experience working in the hospital, when patients are uncomfortable, they're restless. If the bed is comfortable, the patient will feel less anxious and less like they need to get up and get out of bed and get out of here. And they're placing things for the patients like phone chargers and touch screens so that doesn't feel like they're, cooped up in the hospital. It makes them less anxious. Short-term effects of adding these beds to hospitals, I think, would be integrating new technology and prevention of hospital injuries. With any new equipment, there's a learning process. Caregivers would need to learn how to obtain the data, how to trend the data, how to use the systems. And I think once that happens, the data will show how to improve patient care. If smart beds are used properly, caregivers can greatly prevent pressure ulcers and skin breakdown. If the bed is alarming you, the patient is incontinent. Turning and repositioning will improve patient comfort and also monitoring temperatures instead of trying to find a thermometer when it's needed. A lot of times patients, if they're incontinent, can feel embarrassed, so they might not say something. But if the bed's telling you, it might help. There's a graph over here to the right that shows the cost of treating pressure ulcers, and if it would be a hospital-acquired injury, the hospital would have to pay for these treatments. So starting with a stage 1 ulcer, it can cost around $2,000 to treat, all the way up to stage 4, which can be anywhere between $14,000 and $20,000 to treat and help the patient recover. Long-term effects on practice and patient health. The long-term effects of using smart beds can be alarm fatigue, decreased caregiver injury, and improved patient care. There was an article that reported on smart beds that the special features of smart beds may be beneficial, but they beep and chirp as much as all of the other alarms in a hospital room. They can contribute to alarm fatigue. Some models do allow for customizable tones. For example, a bed alarm could sound different than an incontinence alarm, but alarm fatigue could potentially be an issue. Also, OSHA in 2017 reported that nursing assistants have the second highest number of cases of musculoskeletal disease and injuries. These injuries are due in part to large overexertion related to repeat manual patient handling activities, often involving heavy manual lifting associated with transferring and repositioning patients. Often lifting equipment is not available or it can be difficult to find additional caregivers to assist with lifting and repositioning. Overall, smart beds are designed for patient comfort and safety. In the long term, I think the patient will feel that and recognize it and be more comfortable. If they see that the bed or the nurses have help rolling and whatever, I think they'll feel it. Some barriers to implementation that I found while researching these beds are definitely cost. For example, the Hillrom Centrella bed is $16,000. So I work at Penn Highlands Du Bois. There are about 150 inpatient beds. So if you do the math, it's almost a $2 million project. And I do not think that price includes the mattress. That's just for the frame. The Pro Bed, Freedom Bed are about $4,500, and the Size-Wise behavioral health beds are about $7,000. These beds would need replaced, I'm sure. Things break, parts need replacement. You would have to possibly add Bluetooth setup to all the computers to import the data into the medical record. You might need additional equipment to do so. New computer systems, things like that. And you would need like sheets and things that would fit the mattresses to fit the beds. You might need phone chargers to place in the charging ports that are equipped on these beds, and things like that. Recommendations for implementation: I think if these beds are introduced slowly, replace them as other beds break, maybe start just one unit at a time. Education would have to be done on data retrieval and bed use prior to receiving the beds, with like the nurses and the doctors on how to trend temperatures and trend number of incontinence or things like that. Meetings with staff on which models would benefit their unit, and maybe finding donors for grants for funding for these beds since they are expensive. These are just a list of my references. I hope that you've learned a thing or two about some smart beds. Thanks.